Hey, Future Medics, Tina here, your medic mentor, and today we're going over a very versatile medication in your EMS toolkit, and that is ketamine, with a brand name, Ketalar. Ketamine is classified as a dissociative anesthetic, but don't let that intimidate you. What that means is it completely dissociates your body from sensory input. So the patient doesn't feel pain at all and doesn't really know what's going on around them, all while maintaining their airway, which is great for EMS. You're going to see us use ketamine for pain control, sedation, and intubation, but the dose depends upon what we're doing. So for pain control, you're going to see 0.1 to 0.3 mg per kg. For sedation, we've got higher doses at 1 to 4 mg per kg. This medication sets in pretty quickly, usually within 30 seconds, especially if you have an IV. But even giving this IM, 2 minutes. It's about 2 minutes and it's pretty quick. Now this will last anywhere from 10 to 15 minutes, so you're going to want to keep an eye on them for your redose. And we can give this IV, IO, IM, and IN. Now this medication doesn't have a reversal agent like we saw with morphine and fentanyl before. So here's a few side effects that you're going to need to keep an eye out for. Nausea, vomiting is one. Emergence reactions can be one. As people wake up from a dissociative, like ketamine, they are dissociated. They don't know what's going on, where they are, what's happening, how they got there, and that's terrifying. And they can act out accordingly. So be aware that that can happen. Make sure that we're keeping everybody safe. But the big one I want to talk to you about is apnea. It's rare, but I myself have seen it happen. I also see it more often when people slam this medication instead of just flushing it in over a minute or two. Okay, so keep that in mind. This medication does protect the airway and does not usually cause CNS depression or respiratory depression like we saw with morphine, but it can cause apnea. Just out of nowhere, usually one brief moment of it for about 3 minutes, and then it's done. So you need to keep a very close eye on these patients because now you know that this can happen. So if you're sedating someone heavily with ketamine, you should probably have a BVM out in their size just in case. And keep a very close eye on them and their vitals so that you will know if they stop breathing. If they do, you know what to do. You learned what to do in EMT school. You're going to get a good seal, hook your BVM up to oxygen, and you're going to breathe for them for a couple of minutes. Usually 3 to 5 minutes, that has passed and they're breathing for themselves again. If it hasn't, check a pulse. Check a pulse. Pulse is still present. Just keep breathing for them. You know how to do that. Like I said, you already learned how to do that in your last class. So now let's move forward with some contraindications. Contraindications for this one are easy. It's known hypersensitivity and pregnancy. That's it, just the two. This is actually a very safe medication, but it does have some side effects that we need to keep an eye on. So here's your takeaway. Ketamine is like the Swiss Army knife that we have in our narcotics box. It is great for airway prep, for pain control, and for sedation for our patients. And it's usually very, very safe. Just be aware of the side effects of apnea and keep a close eye on their respiratory drive, and everything will be fine. But that's it. That's another one knocked out, and you've done such a great job. I'll see you for the next one.